Hi everyone, welcome back to my channel, H&E Life, and my name is Dr. Cindy Wong, and today I am going to share with everyone some, I guess what people will call unpopular opinions about pathology, or I guess they're more of my opinions that might be unpopular about pathology. That's probably better. I hope I don't piss off too many people, and I hope you guys don't unsubscribe, but I feel like these opinions might be something that might piss off more junior residents, I guess. Please don't subscribe. I don't mean to be mean. I'm just stating some things that I feel like needs to be stated. Okay, let's get started. Unpopular opinion number one. I think grossing is very important, and anyone who tells you to go to a program for residency where grossing is basically a hind thought, they're giving you bad advice because that's really limiting you as a pathologist in the future. So reasons why grossing is important. Number one reason why grossing is important is unless you're able to see enough specimens and cut enough specimens and submit enough specimens, you'll never be able to make a 3D interpretation in your head when you're signing out as an attending about like, I'm reading this gross description written by someone else, and now let me piece back what they're describing about this gross specimen in my head and see which sections they took, if they took the proper sections. If not, I need to tell them to take better sections. And then you also then need to correlate that section that was taken and see what is on the slide. And you need to be able to have done the grossing yourself over and over again on a variety of specimens before you're able to do that 3D correlation. And I feel like as a pathologist, there's no way you're able to sign out complicated cancer specimens if you do not have good correlation between what the specimen looked fresh versus how it looks open versus how it was cut and how it was sampled. If you don't know how things should be properly grossed, you will not know if they did a proper job for you to make a proper diagnosis. That is the biggest reason why grossing is so important, because you as a pathologist will not be able to properly do your job in the future if you do not know how things are grossed. And that said, if your future is basically biopsies, 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 and just biopsies, fine. I agree. Importance of grossing to you is very minimal because you don't really need to know how a thing is grossed. If they just give you a biopsy, you just tell them this biopsy fragment has blah, right? So fine, I guess that I will concede on that. But other than that, or of course, if you're a CP resident, you'll never need to touch a gross specimen again, then yes, it's not important to be good at grossing. But if you are an AP resident who plans to do AP heavy specimens, and if you plan to go to a place that's not just doing biopsies, you should be very comfortable with grossing yourself. And that basically would sometimes be more than just grossing one big a day. That might be meaning you have to gross 1-2 bigs a day. You have to gross routine specimens. You personally have to know how a biopsy is grossed and all of that. And that way you can make sure that what you have on slide was properly sampled and it is enough to make a proper clinical diagnosis. Another reason why grossing is so important is, especially if you're planning to stay academic setting, you need to know how to gross because you will be the one teaching residents how to gross. Sure, there will be PAs who will help, but as the pathologist, you get the final say of how a specimen is grossed. If it's such a complicated specimen that even the PA is quite not sure what to sample and how to cut it, both the resident and the PA will come to you as a pathologist, be like, please help. And if you have spent your entire residency depending on the PA to tell you what to do, then, well, you're kind of stuck. You're now the attending. You're the person who needs to tell someone what to do. And if you have no idea, then what does that say about you as an academic pathologist? It's kind of not good, right? It is not a good thing to cut out grossing from your residency training. It is very, very important that you know how to gross and you know how to gross independently, being able to gross properly, because you should be able to think about what do I need to see on a glass slide, and this is because I know what I need to make a proper clinical diagnosis and proper staging, then I will be able to cut the way I want to cut. So that is unpopular opinion number one. Unpopular opinion number two. You, as the resident, or the fellow, me as the fellow, are there to make sure a hospital runs. Your main purpose is not there for your education. This is no longer medical school. If you're a resident or you're a fellow, your main purpose is to be a doctor and make a hospital run. The hospital is paying you not for you to sit there and learn, but the hospital is paying you so you could do the work so the hospital can keep going. Yes, we are all gonna have to do things we don't want to do. As a resident, as a fellow too, we have to do things that's like, why are we doing this? This is a waste of my time, my education, my blah, 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 blah. And yes, I get those sensations too, but I still do it without putting much of a fuss about it because that's just what's required for the hospital to work, for the department to run, for specimens to be grossed or cases to be signed out. If I have to go track down a slide because it got lost somewhere, the attending is not gonna do it, so I'm gonna do it. Or, you know, if I was a really shitty fellow, I could be like, hey, resident, go do it. Honestly, I don't think most of us will do that. So over the years, as I've gotten more senior, I've heard this from junior residents and things like that. Be like, why am I doing this? My main purpose is to study. I can't gross because that eats away from my education time and it's not educational for my duties. Yes, it's true. Grossing routine and biopsy cases, not really for your education after you've done it a few times. I agree, but the specimens needs to be grossed. If we don't have enough staff to gross it and the specimen just sits there, that's patient care that's being affected. That's patients who had their biopsy done and they're anxious because they have a lump in their chest and they got that invasive biopsy. They were put under anesthesia and they had someone go in there, take a piece of tissue out. Now they have this painful thing that they have to like recover, and they're anxious about their diagnosis because they're like, it could be cancer. I hope it's not cancer. I really hope it's benign, right? The patients are scared. The clinicians be like, okay, I need to start thinking about what's the next move. And you're like, as a resident, well, hey, look, there's all these like junk things over there. It's not educational to me to gross it, so I'm not gonna gross it. But then because the PAs are too busy, the techs are too busy to gross it. If you as a resident don't gross it, then that's patient care being affected. And as a doctor, if you have thoughts like that, you should rethink about like, why did I be a doctor? It's not because you want to make money, right? Well, okay, fine. A lot of people could be doctors because they want to make money, but in the end, we all did the Hippocratic Oath. We all promised to not harm any patients, and by not grossing that specimen, you are delaying their patient care. If it's a cancer, you're delaying the diagnosis of that cancer, you're delaying the treatment of that cancer or the treatment of whatever that thing is because, that thing wasn't grossing that day because you didn't feel like grossing it, right? So this is my very, very unpopular opinion is you are first employee of the hospital, second a person there to learn. So you first need to make sure the hospital is running and the department's running and patient care is being managed before you can start worrying about like, oh, let me learn this. That makes a difference between having that gross in time, having it all worked, and sure, you might have to sacrifice 2 hours of your study time to make sure this person get their diagnosis, but it's worth it because the patient gets their diagnosis, they get their proper treatment, and that is your number one priority as a doctor, right? So, hey, I don't know. I feel like there are some residents out there who don't understand that, and I really hope I'm not being mean. I just want to have people realize pathology residency is easy compared to other residencies. But like, yes, our lives is a little easier. Our lives is more focused on learning. And yes, I agree. You need to be able to learn a lot of information really fast. And a lot of things we learn in med school doesn't really help us with the new information we're learning. But the first priority is patient care and then your education. So yes, you might have to sacrifice your education a little bit to make sure everything runs smoothly. And like I said, this is my unpopular opinion. Please don't hate me for it. My last unpopular opinion I have to share is when people complain that they're being overworked. I'm not saying they're all liars. What I'm saying is there's being overworked where it's truly malignant. There's too many cases assigned to you. There's too many things you have to gross, and there's too many expectations for you to do this, and this, in addition to studying. And, if you had to do the first 3 and sacrifice your studying, and then then your attending comes back and be like, why are you so stupid? Then yes, that is truly overworking and that's truly malignant environment, and that should be fixed, or maybe you could possibly thinking of transferring out of that program. But I completely support people who need help in that situation, where I feel like there are a certain number of people who say they're overworked, they work too much, but is it truly a issue of them working too much, given too much work, or is an issue of inefficiency? And I'm not saying this is like, oh yeah, okay, sure, you work too hard. No, that's not what I'm saying. It is very important, especially this is at least what I feel like. Once I guess if I become a program director, but I really want to become a program director. So I hope this is once I become a program director, if a resident comes to me and say, we are working too hard, I want to individually sit with each and every one of them and be like, all right, tell me, how are your hours like, and what do you do in a day, and how do you do this in a day? And it could be something as simple as this person is not previewing efficiently, or they're not that great at grossing, and maybe to help them be more efficient is they get a little more training in grossing. Or it could be a variety of things. It could be that they're not organizing their time properly, they're kind of really scattered, doing a little bit of this, a little bit of that, and then because you're doing a little bit of everything, nothing really gets done, right? I think it's very important, if a person comes or a resident complains that they're overworked, one is to not blow them off. Two is to make sure it's not a true they're being overworked, because honestly, as this is a common trend in most places, every year the specimen volume goes up, and every year it's the same number of residents. So eventually, what residents had to do 10 years ago compared to what residents have to do now, they had a less work volume than what residents have to work with now. And I agree, at a certain point, there's too much work for a resident, and it's irresponsible for intending to expect that a resident keep doing everything and everything, because the volume has gone up. I'm sure the department has hired more attendings, but they're never gonna get more residents unless they have approval to get more residents, and that takes a lot of effort, and it takes a real issue with the program before people start to be like, yeah, we need more positions. There's difference between working 80 hours versus someone who's working really efficiently, given the same level of training, given the same amount of work, can finish that work in say like 60 hours, and this person's working 80 hours every week. There might be a discrepancy between that because of inefficiencies or a lack of understanding of how to be better at a certain thing. And like I said, this is not an all-inclusive list, but these are reasons why some people might be working too many hours, but it's not because they're being overworked, they're just not working smart, I guess. So yeah, those are my 3 very unpopular opinions, and I'm pretty sure this will probably be the very first time that this like button is gonna get pressed a ton of times, and there's gonna be all these nasty comments down below, and I'm gonna get chewed out by people who are like, how dare you say all these things, you know. But like I said, these are my opinions, and I feel like they're important viewpoints to be made, and I'm gonna hold steadfast to them. And let's all remember, I'm a fellow now. I'm still a trainee. I finished 4 years of residency, so I've been where you guys are. And when I say this, like, this is really recently. I started a residency in 2017, and I'm still doing fellowship. So I'm still a trainee. I've been with everyone in the trenches and working, and you know, I'm not making these opinions as some jaded attending who's like 20 years out of training. I have no idea how much harder it is now to get into med school, to get through med school, to get through residency, and so on and so forth, and all the education you have to learn now. Because when they were in med school or residency 20 years ago, I'm sure their textbooks were half the size of our textbooks. So what I'm saying is, I feel like since I'm so fresh out of training, or still sort of in training, I feel like I could share these opinions with all of my training experience behind me, and this is supporting what I think. And once again, please don't hate me after this. These are my opinions. They don't have to be your opinions. I'm not going to impose these on you, but I just want these thoughts to be out there. All right, so yes, please don't unsubscribe. Please don't press the dislike button too much. Please don't leave too many mean comments down below. But if you like my channel and you like what I share, please like and subscribe. And thank you, everyone. And I'll see everyone next time. Bye.